This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our webinar on pinched nerves. Today's webinar is brought to you by the Back and Neck Pain Center at Mather Hospital. At any time during the presentation, please feel free to answer any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can with the time allotted. Once the presentation concludes, your questions will remain anonymous and protect your privacy as always. Today's presenters are Dr. Benelli, Chiropractor and Administrative Director of the Back and Neck Pain Center, Caitlin Conville, Nurse Practitioner, and Lisa Puglisi, Physical Therapist. Go ahead, Dr. Ben.
Good afternoon, everyone. My name is Dr. Benelli. I'm the Administrative Director of Mather Hospital's Back and Neck Pain Center. In addition to that, I'm a practicing chiropractic doctor in Selden for about 37 years. So I have a lot of experience in the spine care focus, and today's webinar is going to focus on the spine and regarding pinched nerves that can occur in the neck and back, what can cause them, what you can do to help yourself, and what others can do to help you if you have a chronic pinched nerve. So back pain is prevalent not only in our society here in America, but it's prevalent globally throughout the world. It's been labeled as one of the leading causes of disability, and actually it's the #1 leading cause of disability globally. And even in these pandemic times, because everybody's working from home and everybody's been limited to their activities, it's even surfaced more and become a huge problem during this pandemic. 31 million Americans will experience low back pain at any given time, and every year an additional 25% will experience back pain as well. As I said, it's the leading cause of global disability. Americans spend a whole lot of money on back pain. It's been estimated to be about $50 billion per year. It's the #1 source for chronic pain, and most importantly, its rate of recurrence is 50% within a year and 60 to 80% within 2 years. So not only is it important to diagnose what may be causing a pinched nerve and managing it, it's equally important to learn what to do to prevent it from happening again, identifying risk factors, and then managing those risk factors. So what are some of the symptoms of a pinched nerve in the neck? Now, I know a lot of people have experienced this from time to time, but symptoms that are common are weakness, muscle pain, stiffness, and spasm. Some people will feel numbness and tingling in their hand. Some people can feel neck pain that radiates into their shoulder, down their arm, tenderness, and even headaches. Headaches actually are very common from the neck area from a pinched nerve, and they can occur from the base of the skull and go up into the head region and even into the temples. And sometimes you'll notice that when you're moving your neck from range of motion up and down, side to side, it can cause stiffness or pain, and these could be very well signs and symptoms of a pinched nerve. So how about the lower back? So pinched nerves are extremely common in the lower back. In fact, data shows that 80% of the population will experience a back problem at some point in their lives, and actually that number's increased a little bit recently. But people can feel back pain, like you can see if she's holding her lower back. It can cause pain to radiate into the buttock, into the thigh, even all the way down to the foot. You can feel weakness in your muscles. You can get numbness or tingling in your leg or your thigh or even in your foot. And even knee pain can be a sign of a pinched nerve. So what are some of the causes and risk factors associated with neck and back pain and pinched nerves? Well, obviously stress is one big one. In current times, everybody pretty much is under stress right now with everything that we're going through, not just working from home, but being home, being isolated, social isolation, and now, however you feel about the vaccine, if you want to get the vaccine, all the stress associated with not enough supply to meet the demand. Poor sleeping posture is another one. If you sleep on your stomach, that tends to aggravate or even cause pinched nerves. Poor posture, so sitting nice and erect, and we've talked about this before in our webinars, and we'll talk about it a little bit again today. Trauma from an accident or an injury, overuse from repetitive exercise or work routines, bad lifting techniques. If you're overweight, that is definitely going to contribute to a pinched nerve or even cause one, and certainly being out of shape. So what are some of the anatomical reasons for pinched nerves? Well, if you look at these pictures, we'll start with the top left. You're reading top left, and we'll work our way down. A very common one is herniated or bulging discs, and that can very commonly not just cause back pain, but it can cause sciatica. You can see that the red colored shaded area is pain in the leg that originates in the lower back. So very often people will say, I have a pain in my hip, or I have a pain in my thigh, maybe even all the way down the leg, and they think they have a problem with their leg, when in fact it really is a pinched nerve in the back. The picture next to the red shaded area, you can see it's pointing to a disc that's bulging out to the right side near that yellow nerve. And that's another reason for a pinched nerve. When that disc moves from the middle, it actually pushes out and hits that nerve. If you look at the picture up on your right-hand top corner where it says pinched nerve, we're looking at two vertebrae, one vertebrae on top of another. In between there, there's a space that's called the disc. And then there's a hole or an opening where the nerve is. If you look at the very top, that yellow nerve is kind of unpinched. When you look at the one in the middle, you can see that that vertebrae has shifted backwards. It's misaligned. It's kind of arthritic as well at the joint, and it's irritating and pinching the nerve. That is extremely common in the lower back and in the neck, and that's another source for a pinched nerve. Something that happens to older folks is something called spinal stenosis, and that's the picture down on your left-hand corner. And typically that's when we get older and there's a lot of wear and tear and arthritis that's into our spines. It narrows the canals where those nerves actually exit, and that too can pinch a nerve. And then on the bottom right where it says pinched nerve, you can see a picture of a herniated disc. It's actually pointing to a disc that looks like it's bulging outwards, and you can see it squeezing and pinching the nerve. If you look at the picture above, the disc there is kind of symmetrical. The nerve looks unimpeded. It's nice and yellow, and there's no pinching or effect on it. So those are most commonly the reasons what we see in the spine for pinched nerves. So how do we diagnose a pinched nerve? Well, the most common way is through a physical examination and a history, and then imaging. So what kind of imaging do we do to diagnose pinched nerves? Most typically it's X-rays first, and then MRI scans. So we're going to look at a couple of X-rays of the neck. Now look at the picture on your left, where you can see two red arrows pointing to a cervical vertebrae and disc. And that disc is actually thinner compared to the ones above and below. So what does that mean? It means that that disc is deteriorating. And as that bone approximates the bone below, that disc will smush out, kind of like an ice cream sandwich. If you smush the ice cream wafers together, the ice cream will bulge out. It's the same thing with a disc like this. And then arthritis starts to set in, and you can see the right-hand arrows pointing to some bone that's excessive. There's a hole right there where the nerve comes through, and that nerve can get pinched there. Specifically now, if you look to the far right picture where the two white arrows are, take a look at the holes that we're looking at. When you look at the hole that the two arrows are pointing to, that hole looks very narrow, like somebody pinched it. When you look at the ones below and above, those holes are kind of oval, almost ear-shaped, and very open. What travels through that nerve is what travels through that hole is a nerve. The one where the arrows is pointing, that hole is half the size that it's supposed to be, and for sure the nerve is being pinched in that hole, and that's the cervical spine or your neck, and that can cause neck pain, that can cause pain in the shoulders, and it could even cause pain down the arm or tingling and numbness. So those are pinched nerves commonly that we see on imaging in the neck. The middle picture, that's an MRI of the lumbar spine or your lower back. And if you look at the picture on the right, where you can see the disc is kind of bulging outwards, you can see red around that disc. Well, if you look at the disc above it, it's thicker. The back end of that disc doesn't invade that white space, almost like a water tube. But that bottom one where you see the red, that's bulging outward. It almost looks like it's mushroomed out. That's a herniated disc, and it's invading that white space right where the nerve is. And that pinches the nerve, and that can cause back pain, buttock pain, pain down the thigh. It could even cause numbness all the way down the leg to the foot. Very common. So what can you do to help minimize a pinched nerve if you have one? And these are some hopeful home tips that would help. Sleeping better. So sleeping is important. The position, the posture of your sleeping is important. You should never sleep on your stomach. You should always sleep either on your side or on your back. If you have back problems or pinched nerves in your lower back, you want to put a pillow between your thighs. And if you're laying on your back and you prefer to sleep on your back, you should put a couple of pillows under your knees. Medicines, over-the-counter medicines typically can help, like NSAIDs or Tylenol. Stretching every day is extremely important. And we're going to talk more about this later too. Your posture is extremely important. How you sit, how you stand, how you sleep. If you're slumping while you're sitting, slumping while you're standing, that can absolutely either cause a pinched nerve or exacerbate a pinched nerve. And in today's times with this pandemic for the last year, so many people are home, working from home and sitting at their kitchen tables, and they're sitting, instead of nice and erect, they're sitting like this where they're slumping. That puts your neck forward. And when your neck goes an inch or two forward, it's like putting a 20-pound weight on your head all day long. That definitely can aggravate your neck, cause pinched nerves. Therapy, we're going to talk about therapy and how that can help pinched nerves. And certainly ice and heat helps. And ice is always good in the beginning to reduce inflammation and pain and muscle spasm, and then switching to moist heat in the chronic phases. Next slide. So at home, again, to review, you can rest. You can use ice to reduce inflammation. Absolutely look at your posture. Reduce time sitting. Now, it's hard to do when you're working from home, so it's important to take breaks. But sitting has been referred to as the new smoking. In our society, even pre-pandemic, sitting was referred to as the new smoking because so many people just sit around and do nothing. It's really important that if your job entails a lot of sitting, that you get up and move and take a lot of breaks. If you're not working from home, you have to incorporate time to get up and move, just like stretching. Moist heat's good, and you could always take Tylenol or Advil, which are over the counter. So the importance of posture, you can see from the pictures on the right, when we're talking about standing posture, posture is important because it minimizes stress to your mechanical joints, your muscles and ligaments, and it can prevent pain from even happening to begin with. Notice that the picture on the right, on the very top picture, her head has moved forward like I talked about, and her shoulders are slumping forward. That puts an inordinate amount of stress in the neck and the upper back. Look at the pictures in the middle. The green check shows proper seated posture. Notice how the thighs and the calves are perpendicular to one another. The spinal posture is erect, and the head is right over the shoulders in parallel with the rest of the body, and that the monitor is eye level. That's a huge contrast to the picture on the left, which causes pinched nerves and back pain. And then we talked about sleeping posture before, and this is a good picture showing it. Putting a couple of pillows under your knees if you sleep on your back, and then put a pillow between your knees if you sleep on your side. So exercises and stretches, these are really important. You have to take time to move every day. You have to take time to exercise. And exercise could be as simple as just getting outside and walking. It hasn't been that bad weather-wise. Walking is really a good exercise for your posture and your neck and back. Taking time to do stretches, going to yoga. These are all really good things that you have to incorporate into your everyday life. Next slide. So we're going to go on after this slide to a few things. We're going to talk about different treatment approaches, assuming you have back pain that has been persistent and it's been resistant to some of the things that we've talked about and you've been already doing. We're going to talk about different types of therapeutics, ranging from the least invasive and most conservative, things like chiropractic medicine and physical therapy and rehabilitation, to things like interventional injections if they're necessary, and lastly, at the very last resort, spinal surgery. So we're going to stop for 60 seconds, and I want you to take a look at this survey. This is a survey that we all use in clinical practice that insurance companies ask us to report on, and it's basically a functional assessment tool that we call an oswestry. So I want you to just take a look at this particular tool, and I want you to just check off how many apply to you. We're going to come back to this towards the end of the seminar and talk about the importance of this survey and why it's important as far as measuring your function and your functional disability. So let's wait for 30 seconds for everybody to answer that. And then we'll move on. Okay, so we're going to move on, and we'll come back to this at the end. There's one question that came in on the chat, so I'll answer that question later because we're going to go through different types of therapies, and that particularly was about chiropractic medicine. And I'll be talking about chiropractic medicine that may actually answer your question anyway. So what kind of treatments can be provided for a pinched nerve that just is persistent, it's not going away, it's been chronic, it's annoying you? So there are varying options. There's chiropractic care, there's physical therapy, acupuncture and massage therapy, interventional injections done by a pain management anesthesiologist, and lastly, spine surgery when everything else has failed. So I'm going to touch on just the basics here, and then a physical therapist will talk more specifically about what she does, and I'm going to talk about chiropractic medicine. But physical therapy is a great option. You can see here that the top left picture, the therapist's hands on the woman's back, and she's actually performing a particular therapeutic modality called McKenzie treatment, and our physical therapist Lisa Puglisi is going to talk about that. And then you can see on the bottom picture on the physical therapy side, what they spend a lot of time is actually working on the core, because core stability, core strength is so critically important for not only helping a current problem, but like we talked about, it's one of the risk factors for recurrence of back pain again and again and again. If you never strengthen your core, you never stabilize your core, history will only repeat itself. And that's one of the reasons why recurrence is so high, because people never change what got them there in the first place. On the chiropractic medicine side, you can see on the top picture, there's a table that I use pretty much exclusively called the Cox Table. And it's a table that actually distracts the joints and the discs. And it only not goes back, it goes up and down, it goes back and forth along the body axis. And I'll talk more about that in a few minutes. So as I said, I'm not only the administrative director of Mathers Hospital's Back and Neck Pain Center, I'm also a chiropractic physician that's been in practice for 37 years. So I have a lot of clinical experience. And it's one of the reasons why I started and founded this program at the hospital, because integrated care is so critically important for helping people with chronic spine problems. In other words, practicing in silos and only one doctor trying to treat somebody, in my opinion and in my experience, usually doesn't work all the time. A lot of times you have to have a team of providers, and it has to be interdisciplinary. And that's the strength of this program that I founded, and that's become very successful here at Mather. So I'm going to talk about chiropractic medicine, and then I'm going to have Lisa talk about physical therapy, particularly McKenzie. So what types of back and neck pain care do chiropractors provide? I'm assuming that in our audience, there's some people who have been to chiropractors, but there are different things that chiropractors do. And equally of interest is that if you went to 10 chiropractors down the street, you would probably experience 10 different experiences at each of that office. So unlike medicine, chiropractic care tends not to be standardized. And in my opinion, chiropractors who have many tools in their toolbox are the ones that get the best clinical outcomes. So for example, on the top left-hand picture, the therapist has his hands on this woman's back, and he's about to deliver a manipulative thrust, which is what people refer to as back cracking. It's generally a safe technique, but it's not something that should be done on everybody. People who have osteoporosis or severe arthritis or spinal stenosis, people who have rheumatoid arthritis, obviously people who have compression fractures, should not have this technique. There are plenty of other techniques that are just as successful and sometimes even more successful. And one of them is the Cox Table. And you can see on the bottom row of pictures, in the very middle picture, the doctor has his hands on her neck. And that table up by the neck piece, excuse me, will move up and down to distract the joints and actually distract and decompress the disc. The doctor on the right is actually going to move the bottom piece of that table up and down, and that basically decompresses the disc by decreasing the pressure that's built up. And then to the left of the picture, you can see where it says auto distraction and that arrow is going back and forth. That table actually goes back and forth and distracts the disc. So in answering that one person's question, does chiropractic medicine actually reduce the bulging of the disc? The answer is yes. And by doing these particular techniques on the Cox Table, research has shown that the intradiscal pressure decreases when these techniques are done. So picture a disc like an overinflated balloon. These particular tables help to deflate that balloon. I'll talk more about that in a minute. So what other supportive types of spine care do chiropractors provide? Well, chiropractors perform a lot of physiotherapy modalities. You can see in the top pictures on the top left, that's an ultrasound machine. And these are passive modalities that actually help to reduce in the acute stage and subacute stage of a problem to reduce inflammation and pain. The top right picture is a cold laser therapy. This is actually providing cold laser, infrared laser, to heal the tissue. Chiropractors provide exercise rehabilitation. You can see on the bottom pictures that the one woman is using bands to strengthen her neck. And then I'm a big believer in the ball, using the ball as an exercise tool to stabilize and strengthen the core. And then many chiropractors like myself have acupuncture and massage therapists in their office and provide that care as well, because those are really very valuable tools and adjunctive tools to helping reduce inflammation, muscle spasm, and pain. Next slide. So again, the Cox table. So this doctor, his right hand, his hand is on the spine. The bottom left hand is on the table's handlebar, and that piece is going to go up and down while the doctor's applying pressure to the disc and joint with his right hand. So what it does, like I said before, is it reduces intradiscal pressure by exerting centrifugal force, and it actually mobilizes the facet joints. It moves the joints of the spine into alignment and into better mechanical mobility without doing that high crack technique that in some cases is not really a good idea to do, and in some cases patients just don't want to have. Next slide. And lastly, before I finish up on chiropractic care, if some of you watching have been around for a while, you know, chiropractic has gone pretty much a 180 with the AMA and in the medical field, and has pretty much become Main Street USA, and now even mainstream medicine. Many years ago, if you'd ask the AMA or a medical doctor, should I go to a chiropractor, the answer would have been resoundingly no. Today, there's been so many research studies in the last 5 to 10 years, random controlled clinical trials that have been published in some very reputable spine journals that have shown that chiropractic care is not just effective for acute back pain, it's effective for subacute and chronic back pain. And recently the AMA has actually suggested that their physicians actually refer to a chiropractor as one of the primary initial portal of entry for people with pinched nerves coming from the neck and back. So the AMA has done a complete 180 on chiropractic manipulation and chiropractic care. Next slide. So I'm going to introduce Lisa Puglisi. Lisa is a physical therapist here at Mather Hospital. She's certified in McKenzie. I'm going to let her explain a little more detail what McKenzie is and how that can help pinched nerves. Lisa?
Hey everyone, I'm Lisa Puglisi. I'm going to discuss a little bit about what we do for a pinched nerve at physical therapy. It can commonly be referred to as a derangement in the PT world, and a derangement can present in a lot of different ways. So a little bit like what Dr. Ben said earlier, we're just kind of in a broader sense trying to see what kind of symptoms you have. So it may be local just to your spine, or it could radiate down into your arms or your legs. It can come and go, or it could be constant. And the symptoms can vary. So it depends on movements or positions, but it can change. It may not be the same symptoms that you're feeling every time. So here at Mather, we have therapists that are certified and highly trained in the McKenzie Method. And that's really an effective and evidence-based way of treating the spine, and that's what we tend to use most when we're treating our patients. And really what that is just a series of repeated movements that we use to assess you, to manage you, and then also we use it for treatment. So there'll be a specific exercise that we find that is best for you that we use for pain relief. And it's really patient-centered. So the patient can become very independent with us, because if we give you these specific exercises and you're diligent with doing them, they are actually very effective and you get great results, and you get better fast, which is everyone's goal. And then we also work a lot on postural correction. So in our examination, the first thing we do is really have you stand up. We'd assess your posture, see how everything is aligned or not aligned. We also go into neurological testing if needed. So that could be, doing reflexes, checking your sensation, which we would do mostly if there was symptoms going into the arms or the legs. Next, we would go into your range of motion and check all of the planes to see where there's a limitation. And lastly, we go into the repeated movement testing, which is really the McKenzie portion of it. And we would start with doing a specific movement 10 times and kind of see what your response is to it. So usually we start with just forward and backwards movements. So that could be flexion, and we could do that in either standing, lying down. We may even do it in sitting, and kind of see how you respond to those things. And then we may also go into side movements, which are side glides if needed. What we're really doing when we're doing that is kind of trying to find your directional preference. So if we use this picture for an example, if you come into us and you have pain that's radiating into your leg, and we give you, let's say, extension exercises, and we have you extending backwards, all of a sudden after 10, maybe it's not so bad into your leg, maybe it's starting to move up into the thigh. And we can give you 10 more of those exercises, and all of a sudden now it's centralized to your low back. That's really what we call centralization. I think this slide's a little off. Because this is supposed to say centralization and peripheralization. I'm not sure if the next slide might say it. The picture is correct, but yeah, it's not in there. That's okay. So basically, it would be centralizing, kind of like the picture is showing here. What would happen if we did a movement that would aggravate you is it would actually go in the opposite direction, and all of a sudden you might start to get either more intense pain into the leg or go further down into the leg, and that's called peripheralization. So that's what we would want to avoid. You can go to the next slide. So once we do find the directional preference, then we focus on doing that specific exercise, and it's usually about 10 times, but it's frequently throughout the day. So if in our example before, we're having you do extension exercises, think about how often you're in that forward flex posture. So whether you're driving often or you're on the computer a lot, prepping meals, everything kind of causes you to flex forward and you're not getting enough backward. So that's why we want you to do that frequently throughout the day, generally about every 2 hours. We also will teach you to avoid positions that increase symptoms and peripheralize, which is what we were talking about before. You want to try and avoid that, that specific movement. So in our example, that would be flexion. So we would want to make sure that you're avoiding like forward bending, just bending at the hips to pick something up. We'll also focus on your postural correction. So we may have you use a cervical roll in your pillowcase. So we work on positioning for laying down. The lumbar rolls are really great. It really helps you to have good posture, especially this day and age. If you're working from home, a lumbar roll is a great thing to have just to maintain that alignment. And then we also do, sorry. We also do postural and core exercises to really try and strengthen and stabilize those muscles. And we'll work on bending and lifting techniques. We can work on job specific things that you may have going on that may be aggravating to you. And then once you're starting to feel better and you really aren't having the symptoms anymore, then we would move into what's called a recovery of function. And that's really where we're trying to now reintroduce those movements that originally irritated you, because we want to make sure that you're able to do those things again and not avoid flexion forever. So we would want you to start to do some of those movements and kind of see how you respond. You should be able to gain your range of motion in all of those planes. And then we also basically have you continue with those exercises. You don't have to do them every 2 hours, but just to kind of maintain what you've gained in PT, maybe doing those stretches, once a day. And then lastly, and probably most important, is that we teach you how to manage those symptoms if they reoccur. So Dr. Ben was saying it is likely that you may get these symptoms again, but now you know how to manage it. So instead of letting it snowball into something more severe where you feel like you have to go get treatment, you know what to do to kind of keep it at bay and try and minimize it so it eventually will go away again. So that's everything for physical therapy in a nutshell for a pinched nerve.
All right. Well, hi, everyone. My name is Caitlin Conville. I am a family nurse practitioner, and I'm the nurse practitioner navigator and care coordinator here at the Back and Neck Pain Center at Mather. And today I'm going to tell you a little bit about how our program works. So this is a little slide that tells you a little bit about how we coordinate care here at the Back and Neck Pain Center. So when you make an appointment at the Back and Neck Pain Center, I guide your care throughout the whole process. So that includes obtaining and reviewing any prior records that you may have. taking a very thorough history about your symptoms, and conducting a physical exam that's focused on your back and or neck complaints and your specific individual pain. And as Lisa spoke to, some of the things that we would do, like a sensory exam, muscle strength testing, range of motion, all things that would be appropriate for someone coming in with a pinched nerve. I then present all exam findings to our multidisciplinary clinical care team, which is a team that's made up of providers from different disciplines. So that includes interventional pain management, neurosurgery, physical therapy, and chiropractic. And then we all discuss your case and collectively select the best treatment plan for each patient. At the Back and Neck Pain Center, we also coordinate your first appointment with the appropriate provider for any prescribed treatment, such, again, as physical therapy, chiropractic treatment, or if you needed to see an interventional pain management provider. We also schedule follow-up appointments so that we can monitor your progress throughout the course of treatment to make sure that your condition is improving and to make any adjustments to your treatment plan as needed. As the nurse practitioner, I also address any needs for prescription medication or imaging studies at the time of your first visit, and I review your progress and any results obtained at the time of your follow-up appointment. All right, so how is the Back and Neck Pain Center different? So here at the Back and Neck Pain Center, we provide evidence-based multidisciplinary care, which is customized again by the clinical team and the collaborating physician and guided by myself, the nurse practitioner. When I mention that multidisciplinary care, I'm again referring to the fact that we have multiple providers from many different disciplines who all work together to coordinate your care. So we meet once weekly and we review all patient charts to allow for the providers from different backgrounds to weigh in on the selected treatment plan, and each person can provide their unique perspective. At the Back and Neck Pain Center, we also aim to reduce recurrent episodes of back and neck pain in the future by teaching about adopting a healthy lifestyle, and this includes exercise and diet guidance. We also avoid the use of high-risk pain medications. So while one of the goals is to alleviate your pain, of course, we also want to find the underlying cause of your pain and provide treatment that addresses this underlying cause. And here at the Back and Neck Pain Center, we also identify and address disparity of care factors. So there are many factors that make it difficult for individuals to access treatment, and this can include financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues, and just difficulty managing multiple appointments with different providers. So here at the Back and Neck Pain Center, we aim to identify these factors and provide assistance to ensure that you're able to get the treatment that you need. All right, so this graphic here depicts our approach to treatment at the Back and Neck Pain Center. So we use what we like to call a stepladder approach. And with this approach, we aim to provide the least invasive, effective treatment option for your condition. So for most people, this means starting with conservative treatment, measures such as physical therapy or chiropractic care. And if you have already tried conservative measures and you have not had improvement, or if your condition warrants further intervention, we may start a little bit higher on the ladder, say with interventional pain management or one of our support programs. So in cases when you do have a red flag, signs or symptoms that indicate an urgent condition, we may send you directly to a surgeon. Approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment and recommend additional treatments or steps as appropriate. About 20% of our patients utilize our pain management treatment options, and about 5% of our patients have required spinal surgery. So our overall goal is to provide you with the most appropriate treatment for you, and treatment that will be effective in reducing your pain and will help you to regain function. And if you have any questions about the Back and Neck Pain Center, the type of care we provide, or you'd like to reach out to schedule an appointment, we're going to be providing some contact information at the end of the presentation, and I'm always happy to speak with you and address any questions or concerns you may have. Okay, so now I'd like to talk to you briefly just about the role of diet and nutrition as they apply to the reduction and management of inflammation and pain, which is important when we're thinking about pinched nerves and other inflammatory conditions that can cause pain. So on the left here, we have examples of food that are not the healthiest foods in the world, foods that promote inflammation in the body and promote weight gain while providing very few nutritional benefits. And on the right here, you can see fresh, colorful produce, high in antioxidants, vitamins, and minerals that serve to reduce inflammation in the body. So research shows that our diet plays a significant role in inflammation and pain in the body. And inflammation is an important underlying mechanism for the development of chronic diseases, including type 2 diabetes, heart disease, arthritis, and cancer. Increased inflammation in the body is also found in patients with chronic pain. So by recognizing foods that can reduce inflammation, such as plant-based foods, as well as those that promote inflammation, we can help you to make diet modifications that can decrease inflammation in the body and help to reduce pain. So this here is an example of the anti-inflammatory diet. So on the left, we have the food pyramid for the Mediterranean diet. Again, an anti-inflammatory diet that provides an excellent guideline for how to make diet modifications that will reduce inflammation in the body. So you can take a quick peek at that. Inflammation in the body can be either positively or negatively affected by the foods that we eat. So pro-inflammatory foods, or foods that increase inflammation in the body, include things like saturated fats, which are found in meat, especially red meat, and whole fat dairy products. Trans fats, which are found in hydrogenated oils that are used to make processed or packaged baked goods and crackers. Omega-6 fatty acids, which are found in oils such as corn oil, safflower oil, soybean oil, and in sugar and sugar-laden foods. Anti-inflammatory foods are foods that can help to reduce inflammation markers in the body, and those include foods high in omega-3 fatty acids, such as canola oil, walnuts, and fish. Monounsaturated fats, again, found in olive oil, peanut oil, nuts, and avocado. And in fruits, vegetables, and whole grains. The more colorful, the better, and many different herbs, spices, and teas. Next slide. All right, now I'm going to turn the presentation back over to Dr. Benelli, and he's just going to review with you some of the treatments for pinched nerves that don't respond to conservative care.
So like anything, our goal is to help people get better with the least invasive, most conservative care approaches first. We give you the tools and teach you what to do at home, like Caitlin talked about nutrition. Lisa talked about exercises, but sometimes in some patients that just doesn't work. Our data here at the Back and Neck Pain Center, 80% of our patients get better with the conservative treatments we've talked about, but 20% do not, and 15% of those patients need to go on to some sort of invasive procedure that attacks where the pinched nerve is to help it decrease its inflammation and stop the pain generators. So I'm just going to briefly touch on them. So we have a team of providers that are pain management specialists as well as spine surgeons that we routinely refer to that are part of our clinical team, that when it's necessary, we send the patient to them for consultation and treatment. So for example, we talked about the joints and how the joints can be pain generators. So if that's not getting better with standard medicine and chiropractic or physical therapy, we would send you to a pain management doctor to perform something called a facet block or a facet ablation. So the top left-hand picture, you can see that the needle is being inserted into the joint, and what they inject is they inject generally an anesthetic and some cortisone to look for a temporary response and decrease pain. If that happens, we know that we've identified the pain generator. After a couple of trials of that, then the doctor would do something called an ablation, which is they actually burn that sensory nerve. And that nerve, it's not like you're going to lose a nerve that you absolutely need. That nerve is just a pain nerve, but it helps give people who are experiencing chronic severe pain relief. Secondly, there's epidural injections. It's another needle. This is done under a general anesthetic and generally done in the hospital, where we inject cortisone in by the spine where the disc is being protruded, and it's probably inflaming the local nerve ending, and it helps to reduce pain and inflammation. None of these things, though, it's important to remember, change the anatomy. So exercise and changing your lifestyle, changing your diet, are something that's going to happen anyway. Otherwise, history will repeat itself. And it goes back to that first thing I said, that if you don't change your lifestyle, history will repeat itself because the recurrent rate for back pain is so high. So even if you need to get facet blocks or epidurals, you're going to have to also change your lifestyle and learn how to eat better and learn how to exercise and learn how to lose weight. And if you're a smoker, to stop smoking, because that exacerbates and causes pinched nerves to be worse as well. And lastly, but not least, is spine surgery. When everything else has been exhausted and nothing is helping, the pinched nerve is just there all the time, sometimes spine surgery is absolutely necessary. They would actually go in there and do a minimally invasive technique where they just kind of shave off the disc that's pinching the nerve. If you look at the bottom right picture, you can see that the tool there is actually shaving the nerve. Some of the newer techniques are including endoscopic surgery, where you're in and out the same day. So surgery sometimes is necessary, but obviously our goal is to avoid it at all costs. Next slide. So we're wrapping up here. So that tool I asked you to fill out was an Oswestry functional disability tool. And although we're not talking to you in person, I can only really ask. But if you scored 2 or higher, that's a 20% disability. If you were scoring anywhere from 5 or 6 answers to that particular functional disability tool, that means you're dealing with a significant moderate disability that's affecting your life. It's affecting your ability to enjoy life, to do the things you like to do. It might even be working, your hobbies. So that's if you have that, that's a persistent problem that is not getting better on its own. It's probably chronic, and you should actually consider calling us to help you and guide you throughout the process. Our plan takes all medical insurances. We offer telehealth appointments, and I'll show you some of our data in a second. Next slide. So you can see that we routinely do patient surveys, and I'm pretty proud of this because 98% of the people that we survey would not only highly recommend us, they're really, really highly satisfied with how unique this program is. Because again, this program is not like you go to a doctor, he gives you a pill. This is very comprehensive in the way we assess a problem, the tools that we give you on how to do self-care and prevent future recurrences, and that's an important factor. Next slide. If you have any questions at all, we're obviously here to help. If you write down that number, 686-2565, or you can write down that email address, and I'll be happy to answer any questions you have. If you're comfortable doing a telehealth consultation, just call that number. Telemedicine is covered by every insurance company now, and I believe it's still under emergency protocols where there's no copays involved in that. So you can actually schedule a telemedicine appointment to speak to Caitlin. I think I've demonstrated, exactly what you need to do to help yourself at home, how to mitigate pinched nerves. Our providers here talked about what they offer and how effective it is. And I urge you to call or email us for help if you need it. And we'll entertain questions now. So there's a chat section where you can actually see on the bottom a Q&A section. Just go ahead and type your question in, and we'll start answering them.
Great. Thanks, Dr. Ben. Sorry.
I want to thank everybody for attending.
We have one that says, can you recommend a posture corrector to be used when sitting to prevent slouching?
So I'll start with that, then I can give it to Lisa if she has anything to add. So I saw that question before, and I'm going to show you on my phone a picture of something called Upright. Now, I'm in clinical practice, and I recommend this. People ask me all the time, I want to buy one of those elastic braces, those posture correctors that you put on. So in my opinion, it's a waste of money. It doesn't do anything. It can't correct your posture. So there are two things that I think are important. One is, this isn't an expensive tool, and the way it works, it's a very thin, almost like a card device that goes on your upper back. And if you start to slouch, what happens is it starts to vibrate. So it's a cognitive behavioral type of therapy that actually helps you cognitively to retrain your posture. But I'm assuming that if you have a postural dysfunction, you probably have had it for a long time. The muscles that are postural in nature have atrophied and weakened, and that alone is not going to do the trick. You have to do postural retraining and postural exercises. So I'll let Lisa add to that now.
Hi. Yes, there are lots of postural strengthening exercises to help to stabilize. And that's probably going to be your most effective bet, because that's what's going to allow you to continue to do that. Because we could tell you to sit up tall, and then 5 minutes later, you're kind of back down this way because those muscles aren't strong enough yet. So if we get those muscles strong, that will also help you. I did see a question about a lumbar roll. McKenzie actually has accessories that they make themselves, and those seem to be the most effective for us, and they're versatile too. So you can get them off of Amazon as well. You could just put McKenzie lumbar roll or cervical roll, and that will pop up.
And the same thing for that posture device. It's very inexpensive, and it's available on Amazon. It's called Upright. And in my experience, a combination of exercise with this actually work really well to correct posture.
Great.
I see there's another question regarding the Cox Table for someone with scoliosis who has back pain and sciatica. That's actually the best way to treat someone who has a significant scoliosis with back pain and sciatica. That technique the table is actually very good for someone like that, because not only does the table go back and forth and up and down, it actually can rotate, so it actually can go into a position which minimizes the scoliosis and actually then pumps the joints and the disc like we talked about. So the answer is yes. I see there's a question regarding the first part of the presentation. Can we access it on demand? Emily, can you answer that question? Because I know this will eventually be posted.
Yeah, absolutely. So we do Healthy You webinars, which is a health series, and we post all of that content on our website. As for back and neck strictly webinars, because we try and do a back and neck webinar, with different issues that you may have every month. Dr. Ben, I wanted to ask you, we'll be able to send this out individually to everybody who attended. We'll send this final recording to you so you have the link to view it at any time. And they definitely can be put on the website. We just have to discuss that, how we want to go about doing that.
Great, thank you. Any other questions? While we're waiting a minute for more questions, can you put back those numbers and email address? I'm available, Caitlin's available to answer any questions you might have even after we hang up here that may come up. You can call that number if you want to get a consultation and do a telemedicine visit with Caitlin. As I said, we accept most insurances, and now even with telemedicine during this pandemic, telemedicine is covered by every insurance company, and I believe it's completely in full. So there's, if you have questions, you have a chronic problem, you have questions you want answered, feel free to call us or feel free to email us. We're happy to help. Are there any other questions before we go? Looks no. Okay, everybody have a great day. We'll leave this number up for another few seconds so you can jot it down. We'll wait another 10 seconds for any other questions. Otherwise, thank you for attending. Thank you to the presenters for showing up and doing this today. It was very informative, and I hope all our attendees found it extremely informative as well. Okay, everyone have a great day.